Hello, everyone. My name is Gazal, and I'll be doing a presentation for Group 4. Our presentation today is about secondary immunodeficiency disorder. Our group members are Melanie, myself, Josephine, Harpreet, Mariam, and Sasha. HIV versus AIDS. HIV is the virus that causes the infection. It belongs to the Retroviride family, targeting CD4 T lymphocytes, gradually weakening the immune system. A person with HIV may remain asymptomatic for many years, especially with treatment. Not all people with HIV develop AIDS. AIDS is a syndrome that results from untreated or advanced HIV infection. It occurs when the immune system is severely weakened, leading to life-threatening opportunistic infection or cancers. A person is diagnosed with AIDS when they develop AIDS-defining conditions or have a CD4 plus count of less than 200 cells per millimeter cubed. HIV uses reverse transcriptase to make DNA inside the host cell. HIV-1 causes over 95% of the global infections, while HIV-2 is mostly found in West Africa with slower disease progression. HIV is not transmitted through casual contact, saliva, tears, sweat, or insect bites. Sexual transmission remains the leading cause globally, accounting for 70 to 80% of the infections. Risk increases with unprotected sex, multiple partners, or shared needles. About 39 million people live with HIV worldwide, most in sub-Saharan Africa. In the US, around 1.2 million are living with HIV and remain undiagnosed. CD4 T cell destruction is direct cell death from replication, chronic activation of immune exhaustion and T cell synthesis, which lead to limited thymic regeneration or gradual immune collapse. Stages of HIV infection include acute stage, clinical latency, AIDS, and latency reservoirs. Diagnosis. When is a person diagnosed with AIDS? When CD4 T cell counts are less than 200 cells per millimeter cube, or the presence of AIDS-defining illness as mentioned earlier. The tests conducted to diagnose HIV or HIV antigen-antibody combo, ELISA, Western blot, and CD4 T cell count. Adaptive immunity and HIV evasion. Adaptive immune response involves CD8 cytotoxic T cells, which kill infected cells and reduce viral load. B cells and antibodies produce IgM, which then turn into IgG. That leads to neutralization plus ADCC. In this slide, you're looking at the treatment method for HIV with the use of medications such as tacrolimus, cyclosporin, and sirolimus, which has a risk of toxicity. So how is this related to pharmacy? Pharmacist's role is going to include medication review and safety, optimizing ART, adherence counseling, side effect monitoring, preventing opportunistic infections, and patient education and empowerment, collaboration, and continuity. Latent stage of HIV failed during the latent stage of HIV. Viral latency and reservoirs. Latency is defined as silent integrated provirus. The main reservoirs are going to be resting memory CD4 T cells, macrophages, and long-lived cells that do not express the virus and therefore evade immune detection. During HIV mutation, reverse transcriptase errors lead to frequent mutations. Immune system is always chasing and moving the target. Consequences are persistent infection and drug resistance, which leads to